What if the biggest barriers to understanding a health compound is simply being able to get enough of it? Welcome to From the Vault of the MonellCenter. Sometimes, advancing medicine starts with understanding what's in a leaf and how to get it out. In the second part of a From the Vault presentation from 2020, Monell's own Dr. Catherine Peyrot de Gachons continues the story of oleocanthal and oleacein, two compounds in extra virgin olive oil with promising health benefits, including anti-inflammatory effects, first identified by Dr. Gary Beecham. Dr. Peyrot de Gachons points out that while research has clearly linked olive oil consumption to cardiovascular protection, oleocanthal and oleacein are still understudied because they're so hard to get. They do exist in olive oil, but in relatively small amounts, making them difficult to isolate and study in meaningful quantities. So, Dr. Peyrot de Gachons and her team found an unexpected alternative source: the common privet plant. Dr. Gachons talks about developing a simple extraction method and how even small changes in the method can dramatically affect how much of the compounds you recover. This work builds on decades of work at the MonellCenter, showing how curiosity about taste and irritation can lead to real-world insights. With that said, here's Dr. Peyrot de Gachons.
So this was a really important step, and as far as I know, no other region in the world, and cardiovascular protection is the only claim so far in Europe. And so there's nothing about protection against other chronic disease. More studies are needed, and they do exist. There are some studies, and here I'm just showing you a couple of the very recent reviews talking about the potential protective roles of those saccharidoids in different chronic disease. And when you look at those reviews and the literature in general, you can see that there's a certain number of in vitro studies. There are some animals and few human studies, but they're really mostly done with hydroxytyrosol and oleacein. For oleocanthal and oleacein, the studies are really scarce. And I think that part of it is due to the lack of pure compound, the lack of availability. It's relatively easy to get oleacein. There is a lot of oleacein in olive tree leaves. It's easy to buy some hydroxytyrosol. There are quite a bit of it in byproducts of the olive oil productions. But when you look at the composition of the olive oil, there's actually very low amounts of hydroxytyrosol and tyrosol. There's some oleacein, and really the main saccharides are oleacein and oleocanthal, and those glycans here. We thought that we should look elsewhere in the lab. We are very interested in working with oleocanthal. We think it's a promising compound. We hope to keep working with it and to have more people studying its health benefits. So we look elsewhere, and naturally we looked in the olive tree family, which is the Oleaceae family. And you can see here that there are many different genera in this family, one of them being ligustrum, which in English we call it privet. And this plant, this genera, as sources are origin in Asia and some origin from Europe. Ligustrum vulgare, notably, is probably the most popular decorative shrub in Europe. It's very easy to prune in different shape, and it's a fast grower. Moreover, the common privet is actually an ancient medical plant. The fresh leaves were masticated to alleviate oropharyngeal inflammations and also use an analgesic for dental pain. It's still used in some region. And it was looking at those pharmaceutical properties that this team in Poland in 2008 published this paper where they wanted to know more about the composition of the Ligustrum vulgare, or common privet leaves. And by doing this work, they did some guided fractionation, and they found notably two iridoids, which they call oleocanthal and lixtroside aglycons here. And when you look at their structure, you see that it corresponds, it's oleocanthal and oleacein. So it's really after this, based on this publication, that we became really interested in Ligustrum vulgare leaves and tried to find a local source, as I show you with a picture of Louise. We hunted around and found some, and then started to develop a method of extraction. Here I'm just showing you the main step, not so much because it's fancy, to the contrary, it's very simple. And in fact, it's very easy to do anywhere and to scale up. And basically, we break up the leaves to release all the compounds. Then we filter to remove the leaf debris. And then we extract this aqueous phase with a solvent, which is a 50-50 ethyl acetate hexane solvent. And then we centrifuge to separate both phases and only keep the solvent phase. And then we do analysis or isolation from this extract. What I want to show you after in the next few slides is that this is a very simple method, but each step, depending on how it's conducted, has really drastic impact on the presence, on the recovery of the compounds.